This meeting is being recorded.
Very good evening, everyone. I'm Dr. Venkatesh Karthikeyan, MD Community and Family Medicine Postgraduate Resident from AIMS Patna. I'm glad to see that more than 500 medical students and young doctors from lengths and breadths of the country have registered in today's webinar. In the past year, IMA Junior Doctors Network has organized a series of webinars for the benefit of our junior doctors and medical students. In recent times, we have collaborated with the Ministry of Health and Family Welfare, AIMS Delhi, IAPSM, KAHO, Star Health Insurance, Max Group of Hospitals, and with many national and international faculties. We got excellent feedback that our webinars are helpful for young doctors, and hence we are continuing this webinar series. As an MBBS student, I was very much eager to deep dive into research, and many of my friends had similar interests too. A boon for people like us is the ICMR STS, which is a short-term studentship offered by ICMR to kindle research interest among medical students. But as MBBS students, you might be eager to get this grant, but might not have proper guidance for it. You might have several questions in your mind, like, I don't know anything about research, all I have is interest. Am I eligible? How to find a good guide? How to find a good research topic? Will this affect my studies? How to write a good winning proposal? Etc. etc. The Indian Medical Association Junior Doctors Network is organizing this webinar on basics in research for beginners to answer all these questions. I would like to thank our National Chairman, Dr. Srijit Sir, and our JDN Secretary, Dr. Parul Ma'am, without whose guidance and support, this webinar would have not been possible. Now, I kindly request Dr. Srijit Sir to give the opening remarks.
Thank you very much, Dr. Venkatesh, and a very warm welcome to Dr. T.S. Anish, today's faculty, and also to all my dear little children and the young doctors of the country. In fact, we are quite overwhelmed that, the response had been huge. In fact, Venkatesh, when me and Venkatesh discussed yesterday, he was telling, sir, we'll have at least 3 to 4 days notice to let this program happen. But I told, let us try, because I believe that the ICMR has given a deadline of later this week or something like that. And many students were, in fact, asking me whether it will be possible to give some sort of orientation. So I thought that instead of speaking to a few of them personally, it would be good to have an all India webinar where, our children from all over the country can participate, and also the young doctors can participate. And as Dr. Venkatesh told, research is a very, very important area, which is often ignored, often due to fear. We are not confident enough whether we can do that. And people, including me, usually shy away from doing research, though we are very good at treating patients, managing health, public health, and so on. So that is why, we want to make it very simple, and we want to tell you what are the basics of medical research and why and how we should do that. It's our responsibility that we contribute to the growth of science. We are all scientists in one way or the other, and we all have to do. We are all doing research. We are all learning every day, and it is imperative that we know the scientific terms and scientific parlors and scientific ways and methods on how to go about doing that. And the need is quite obvious. That is why we had been joined by more than 500 young doctors and medical students from all over the country. And so that shows how eager you are. And I promise you that we will not stop with this introduction. We will request all our faculty members and try to make it a weekly webinar or a monthly webinar where we will try to get into all the nuances of medical research. In fact, today we are blessed with the presence of Dr. T.S. Anish. He's a very, very close friend of mine, but he is much beyond that. He is a bundle of knowledge. I'm very proud to say that he teaches and guides me also in many of our research and other endeavors. And more than that, he's very passionate. He's a very passionate teacher, and he simplifies things to such an extent that he makes everything sound so very easy. And I thought I couldn't think of a second name when we thought of this research, basics in research for beginners, other than Dr. T.S. Anish. It's very easy to teach PG students, but it's very difficult to teach kindergarten students. And that's exactly what Dr. Anish specializes in. So I'm very sure that we are all going to have a treat for the next an hour or so. And Dr. Anish has simplified matters. He'll be presenting a few slides. And after that, there'll be a question and answer session where you can type your questions in chat box, and Dr. Venkatesh would be reading that out, and Dr. Anish would be answering the relevant ones. And all of you who have joined today would be getting a certificate also from the IMA Junior Doctor Network. So once again, I thank all of you for this overwhelming response. In fact, this is quite inspiring. I thank Dr. Anish for agreeing for this one presentation at such a short notice. And above all, I thank Dr. Venkatesh, who is a veteran in national seminars, who has made it happen at a drop of a hat, and he has assembled all these people and the best of the media, which is ClearNet, and they are going to record that and they are going to make it available in their YouTube channel as well. So it's a wonderful beginning, and we can't expect for a much brighter beginning for beginning research by the beginners. So all the best to all of you, and thank you very much to everyone once again. And now let's start with the proceedings. Dr. Venkatesh, you may kindly introduce Anish, and I think he can start the presentation.
Thank you so much, sir, for your kind words. Now, I'd like to introduce our honorable speaker for the day, Dr. Anish T.S. Sir. Sir is an associate professor at the Department of Community Medicine, Government Medical College, Trivandrum. He is a member of COVID Expert Committee, Government of Kerala. Sir is a public health expert of Kerala Disaster Management Authority. Sir is the convener of Epidemic Control Cell of IMA Kerala and member of Research Cell of IMA Kerala. Sir is a PhD guide of Kerala University of Health Sciences. Sir has more than 50 research publications in peer-reviewed national and international journals. Sir is a specialist in infectious disease epidemiology and research methodology as well. With this very brief introduction, I would like to welcome Dr. Anish sir and request him to take over the session. Over to you, sir.
Thank you. Respected Srijit sir, dear Venkatesh, dear all. I hope that I am able to, you can hear me well.
Yes, we can.
So this is a small introduction to a large topic, which is research, not exactly research, but proposal writing. So proposal writing is a very integral part of research. You cannot write a proposal without knowing that what is research. But for this ICMR program, it is for students, especially undergraduate students. So sometimes we may be very beginners, and sometimes these terms that they have used in this link or this Google form may be difficult to comprehend. So here I am trying to explain what the terms they are using in that particular Google Doc that is shared. You can just go to this Google form and you can fill the form so that you can apply for this ICMR short student fellowship. So you may be aware of that particular link. It was shared by Srijit sir. And at the outset, I would like to thank Dr. Srijit sir for his wonderful introduction, as well as what he is doing for the public health of India as such. So I think because of lack of time, I will go to the topic. So I have got only 10 slides, including this particular introduction slides, as well as the thank you slide. So the content will be only 8 slides. So I am not going to make some burden for you. Please. Okay. It has got this particular link. The ICMR is asking you only 8 questions. So the 5 out of 8 questions are related to your whereabouts, your name, maybe your phone number, your email ID, or which department you belongs to, and all other things. From the question number 6, it is very important. 6, 7, and 8. These are the 3 things that you have to look into. 6 is department in which the STS is proposed. That is actually a very important question, because most of the students, in my experience, they will first at the first notice, they may try community medicine. But I don't think community medicine is it's the best choice. Sometimes if your inclination is towards public health, it is fine. But community medicine may not be the best choice for all students, because your interest is very, very important. So first, this particular invitation from ICMR has come. You can apply for a small grant. That is not for big money. You may get some, maybe 10,000 rupees, say maybe 25,000 rupees. What the exact amount now, I don't know. When I was doing some or helping some students to do this thing, it was only 10,000 rupees. But this money is not very important. Actually, if it is 10,000 rupees or 1 lakh, that doesn't matter. What matter is you are trying to get through this process, and through this process, you are learning a lot of things. And if the proposal is approved by ICMR, you can come out, you can include it in your CV, and it is actually a big credit that ICMR has approved your proposal. So whenever you are choosing your department, you have to consider a few aspects. One of the most important aspects among them is in what subject inside the medicine you have got a special interest. Sometimes you may be personally interested to that topic. Sometimes you may try to build a career in this particular topic. For example, if my ambition is to become a big neurosurgeon in future, better try to take some very simple topic. I'm not going for, I am telling you to go for very complicated topics, but some simple topics related to neurology or maybe neuroanatomy or maybe neurosurgery if it is possible. So that is a very important thing. So you are beginners and you have got a very good future, and you try to build that future along with the studentship program. So that is a very important area while you are discussing the department in which the STS is proposed. That means, first of all, you have to think about a problem. Okay, there is, for example, post-COVID syndrome. That is a very important problem that we are facing now. And it has got many dimensions. It has got respiratory dimension that may be the most common. But sometimes the mild cognitive impairment because of COVID or post-COVID syndrome is also very important. If STS is students, short studentship program or something like that, somebody is asking the full form of STS, that we will discuss in the later part. Okay, this is very important. What you are going to study, that should be relevant, as well as you have got some special interest in it. Because I am trying to build my career in neurology. I have got a passion towards neurology. COVID is a big issue. COVID is creating some neurological issue, like mild cognitive impairment or brain fogging after post-COVID. So I am selecting the topic, brain fogging after COVID-19 or post-COVID syndrome. So my study may be related to neurology, and the department in which my proposal is in a neurology department or something like that. And second part is the name of the faculty guide. I found that it is very important to identify a faculty guide. If I am just looking around, what I can see is we have got fantastic doctors in over most of our departments. They are very good clinicians. Maybe Indians may be the best clinicians all over the world. But if you consider what the research is, most of them are not good researchers. It is not because they have got some lack of quality in doing research, but actually they are not intervene or they are not involved in research process. So that is very important to identify a faculty guide. So when I was sitting in Department of Community Medicine, Government Medical College, Trivandrum, so many people will come to me and will just ask, okay, sir, can you become my faculty guide? So I used to tell them, okay, what is your topic? Then they will say that, okay, my topic is some maybe gynecological issues. My topic is breast cancer. So I may used to tell them, if you are interested in the incidence of carcinoma breast in the community, I can be the faculty guide, and I am very happy about that. But at your level, it is very difficult to study the incidence of carcinoma breast in community level. What you can do is, because it is actually it is a very difficult task to just to go to community and just go to every houses and see whether some ladies has got this particular problem. But it is very easy if you have got a very good guide in your surgery, because so many ladies will come for surgical intervention for carcinoma breast, and you can do very well in surgery. Then they will used to ask me, Okay, I will go to surgery and I will get some connections with surgery. I will discuss with the head of department of surgery and I will get back. And can you again become a faculty guide? So I used to tell them, if you are going to do the study in surgery, better you keep somebody in surgery as your faculty guide because they will have some kind of a stake in the work. That is very important. So that is, I think, for the short fact, this studentship program, one of the very important tasks you are in is to find out the department in which the STS is proposal, and you have to identify a faculty guide. And if there is some community medicine faculty or somebody is interested in epidemiology, somebody can do some statistical analysis, please help the students. Even if you are not the faculty guide, you can help the students, because if you look at our clinical specialty, because of the rush and because of the particular burden of other work they are facing, they may not be aware of the research methodology processes, but the public health people can actually help them. So that kind of a team building is very important, and IMA can facilitate that kind of team building. So the 6 and 7 questions are actually addressed. And if you have got some doubts, you can ask at the end of the session. So can you just move to the next slide? Okay. So that selection of your topic is very important. First of all, your interest, that is very important, because whenever we used to be there in the public, in the medical curriculum, we may be having our own interest. So you have to choose some subject. If you are going to, or if you are have got a fantasy towards pediatrics, better you choose a topic in pediatrics, because it is going to help you a lot. You are trying, at least you are giving a proposal, a scientific proposal which is related to pediatrics. If ICMR is approving this proposal, you are going to conduct a paper. Even without the approval of ICMR, you can do this research at your own, maybe using your own resources. So you are going to do a work. Doing that work, you are going to learn a lot. And after the work, you may have something in your hand as a written thing that you have worked, or you have built a team and you have worked something. That is a very, very important aspect that you can in future. Suppose you are trying to build a career in pediatrics, you can showcase that you have done a work. So that is very important thing. When I am sitting in my department, so many old children used to come. Okay, sir, I have cleared the PLAB, or I have cleared USMLE. We have done a work for 5 years back. I don't have a copy with me. At that point of time, I was not realizing that this is this much important. They are asking me, what is there, did you involve any kind of research work in the past? Do you have the copy of that? So that is very important. So they used to come to my department. They used to take a photocopy of the copy they have presented in the department. It was presented by them only, maybe 5 years back, but they are not keeping a copy with them. That is why they are coming from US or UK and to get that particular paper. So that is very important for you. So your interest, you identify the topic based on your interest. Second one, you be futuristic and you try to identify what is your career and how this work is going to help you in building your career. That is one thing. Third one is your current knowledge. That is very important. If you are very much interested and you are knowledgeable in something, and if you can increase the knowledge to some extent, or you are able to contribute some new knowledge to science, that is also very important. One of the most important thing is feasibility, because at your age you may dream a lot, and it may be very difficult because, as Sri Sir has already pointed out, you have a lot to study. You are not full-time researchers. It may be very difficult for you. ICMR may be giving you a small amount of money, because so you may not be able to find out money. Sometimes you may not be able to find out other resources, material resources, maybe. That is a very important thing. So feasibility is very, very important, and the availability and accessibility of resources, including guides. Guides are human resources. You have got a very good guide in respiratory medicine who is very passionate for students. And if you are able to manage some ICMR projects, you can involve that guide. That is also very important. If you are coming from a very resource poor setting where you are not able to find out any good guides, even the presence of guides in a clinical department is also very important. That is about human resource, but not only human resource, the availability of laboratories. In some medical colleges, good laboratories will be there. So I was trying to find out the presence of aluminum or some other heavy metals in breast milk in Trivandrum Medical College, and I was found that it was not present in our medical colleges to find out the amount of trace elements in breast milk. So I had to send the samples to Uttar Pradesh, the Lucknow, MG, that is King George Medical University. So King George Medical University has got a very good lab there. If some students are there in pediatrics working in King George Medical University, they can use their lab. So that is a very important thing. So the utility or the availability or accessibility of resources are also very important. And so many other externalities will also be there that may emerge as you are trying to plan a study. So that is at the outset when you are selecting your topic. Topic is nothing but some area to which you are going to work. How you are going to trim or how you are going to uh, shorten your area of interest to a research proposal or something that we will discuss in the next few slides. We are not going to discuss it in details because if you want to discuss me these things in detail, definitely I need more time. So that, but this is also very important to just hear something the first time, so that when you hear it in the second time, you will just remember or you will learn more. So 8, this particular item, 8, that is the most important item. All other 7 things are is not that much important in this proposal writing. So 8 has got 4 parts, 8A, 8B, 8C, and 8D. 8 is something about writing the project. 8A, ICMR is asking you to give an account of the title of the proposed research project, and it should be concise and yet sufficiently descriptive and informative. That is a very important aspect when you write a title, not only for this proposal. Whenever you write a title, it should be concise and yet sufficiently descriptive and informative. So I found that this particular write-up, even if it is a very small one, it teaches students a lot. If you just go through the lines, you will understand a lot of things. So somebody has drafted it very beautifully without using much words, so that you will be taught by these particular lines. Then they are writing, title may include study design, such as randomized control trial, an observational study, a case control study, etc. If you are trying to do a study which has got a very specific design, it could also be included in the title. For example, I am interested to study the effectiveness of metformin in reducing weight. I am trying to do it in a randomized control trial, so that I can write my title, effectiveness of metformin in reduction of body mass index, a randomized control trial. So the study or the title itself will show that it is a randomized control study that is actually a better design or which has got strong evidence base, and this is a very important study. But for a student, it is very difficult to do a randomized control trial because of so many ethical and other issues that I'm not going to discuss now. So this is very important thing. One is your title should be comprehensive, as well as it should not affect the comprehensibility. So there is a conflict between comprehensibility and comprehensiveness. If you are trying to add a lot of words in your title and make it so comprehensive, the problem is if somebody is reading the title, it is very difficult for them to comprehend. So this is actually a trade-off. That is the meaning of it should be concise and yet sufficiently descriptive and informative. So the rule of thumb is title should not be too long so that it may be incomprehensible. It should not be too long It should not be too short. It should include all keywords. Okay, whenever you prepare a title, it should include all keywords. For example, in my previous title, my drug is metformin. So metformin is a keyword. I am trying to find out the effectiveness of metformin in reducing the weight. Okay, what is the effectiveness of metformin? So the effectiveness word should be there. Metformin, the word will be there. Reduction of weight, that word should be there. If I am doing, it's a small study in one of the medical college, maybe AIMS partner. So you can write AIMS partner in the title itself. That indicate that this is not so generalizable. I'm a poor undergraduate student. I am doing it in a very small amount of people or my patients coming to a particular medical department in a particular institute only. So I'm not trying to generalize it at all, but you just see that I have got this kind of a finding. So it may be repeatable in other settings also. So that is very important. So you just, the keyword means as you just shift your shoes. Now you are not a researcher. You are a reader. Then maybe you may be searching in internet to find out some studies. Now, what are the words that you are going to keep in Google? So if I am interested in effectiveness of metformin in reduction of weight, I may write effectiveness, metformin, reduction weight. Or if I am interested to see any studies in India, I may write India or something like that. Whatever things I am going to write in search engine, you have to put it in your title so that if this study is going to be published, then this is going to be in the limelight because it contains all keywords. So that is a very important aspect while preparing your title. It should contain all keywords, but too lengthy titles will affect the comprehension of the title of your work. And another important thing is the title should indicate the objective as well as the design. If I am going to more detail to these terms, the problem is it will take more time. Objective means what you are aimed for. Okay, in my previous example, you can see that I am aiming to study the effectiveness of metformin in reduction of weight. That is there in my title. Second one is in ICMR is indicating that you can indicate the design. So design is a blueprint of the study because it is very difficult to standardize studies. When I have got a question, I do not have my own way to have its answer. Suppose I want to find out some mango tree. I may come out from my home and I will just wander around and I will find out the mango tree in my own ways. But that is not the way of science. The way of science has systematic. So the systematic way of approaching is what the design means. So in medicine or in epidemiology, there are a few study designs are there. I think most of you might have heard about these designs. Largely, the designs are divided into two, descriptive designs and analytical designs. Descriptive design is nothing, but you are trying to describe something. For example, what are the clinical features of diabetes? You are trying to describe diabetes. Or what is the percentage of people suffering from diabetes in my particular village? So that is a prevalence study. I am trying to describe diabetes, but its burden, the percentage of people suffering from diabetes, which is known as the prevalence of diabetes. These are descriptive studies because you are trying to describe. Second part is analytical studies. Analytical studies means you have got a hypothesis and now you are going to test the hypothesis. So I have got a hypothesis. The obese people has got a higher tendency to become diabetic. So I am comparing obese people and non-obese people, following them up and seeing that whether obese people has got a high incidence of diabetes compared to non-obese people. So it is an analytical study. Okay, for a layman, you just look at the study. If the study comprised of only one group, that may be descriptive. If the study is comparative with two groups, that may be analytical. Because why you want to compare? Because you want to compare to find out one group is different from the other. So you are trying to test a hypothesis. Again, in descriptive studies, you have got cross-sectional studies, case series, even case studies, just like you are doing in your clinics. All are descriptive. And analytical studies, you have got case control studies, cohort studies, trials. Case control and cohort, again, it is very easy to understand. I have already mentioned that in analytical studies, there will be two groups. You look at the groups. If the groups are assembled based on some outcome factor, for example, in my previous example, diabetes and obesity. Obesity is the exposure factor. Obesity will lead to diabetes. That means diabetes is the outcome. In the relationship between obesity and diabetes, I am considering obesity as the exposure and diabetes as the outcome. If I am comparing diabetic people to non-diabetic people, it may be case control study. If I am comparing obese people and non-obese people, this is cohort studies. In cohort studies, two groups will be there assembled based on the exposure. And in case control study, there will be two groups assembled based on the outcome. These are the simple ways to just remember these study designs. Whatever may be the study design, better you keep the name of the study design also in the title, especially if the design is a very special design, like case control study, cohort study, trial, or sometimes a diagnostic test evaluation or something like that. Because if I am going into details, it will take more time because so I am just skipping to the next slide, please. Okay, in 8B, they are just asking, in 350 words, you describe the current knowledge available. That is a rationale, is the heading. And you describe the current knowledge available on the subject area, critical gaps in knowledge, its relevance and application to local, national, and international context, and the research question, which is the project aims to address. Very beautifully drafted, very simple words and very limited words. So if you are following this thing in 350 words or 450 words, this is how we people write the introduction part of a research article. You try to describe the current knowledge available on the subject area. So when you are writing a scientific proposal or if you are writing a scientific article, describing current knowledge available on a subject area doesn't mean that what is in your mind. It is not writing down what is in your mind. As an individual, you may have got your own preoccupied ideas. We as scientists, we are not interested in your preoccupied ideas. Rather, we are interested in scientific facts. So as a scientist, you are supposed to give the current knowledge available on the scientific facts. So that means if you want to write the current knowledge available on the subject area, there should be a thorough literature search. This part should be written based on a thorough literature search. You have to quote the references. Whenever you are saying something, better you quote the reference. Why you are saying like that? It should be there. But in this proposal, usually in proposal, there should be, you have to write the references. But in this particular ICMR proposal for students, I am not seeing any place separately for references. But even if there is no, they are not mentioning about references, better you keep the references. If you are telling that, okay, the incidence of post-COVID syndrome in India is between 10% to 30%, within bracket, you write that based on which paper you arrived in that conclusion. Suppose the author's name is Sri Lakshmi, and if the study is published in 2021, then you can write that Sri Lakshmi 2021. Okay, so somebody can just go back and see whether that kind of an information was given or not. So that is a very important thing that it may be greatly appreciated if you are giving sufficient references for your arguments in your proposal. And second one is critical gaps in knowledge. That is a very important thing. Why you want to do study? Instead, in research, there is a phrase known as inventing the wheel again. Somebody made a round figure based on wood and he's just telling that Eureka, I have found the wheel. There's nothing exciting in finding the wheel, because wheel was founded by the Stone Age man, maybe thousands of years back. So that is not very important or exciting for a modern man. You are using wheels, but it is not about finding wheels again and again. So the critical gaps, you have to address some critical gaps that is known as a research gap. So whenever you write, first you write what is already available or what is already known. And second part, you try to address what is unknown. That is known as the research gap. And you fit your research question. Research question is that question to which your research is going to answer. That is your research question. In other words, it is the aim of your study. So you study, you tell that, okay, we have got some information about the incidence of post-COVID syndrome from this paper. And it is saying that 10 to 30% of people are going to suffer from post-COVID syndrome. And this paper tells that these respiratory issues are there, locomotor issues are there, X issues are there, Y issues are there. But nobody has studied the cognitive impairment because of, that is the research gap. Nobody has studied the burden of cognitive impairment that the old age people of India has got because of COVID. So I am going to study that aspect. I may not be able to study the entire India, but as a medical student who is sitting in a particular medical college, I can definitely come out with something that is available in my college or my institution. So that is your research gap. So it should include what the study aimed for, and better you have to keep your references also. Next. Okay, 8C is a very dedicated area. I think it is because you are children, and compared to adults, children has got a peculiarity, a quality that they can ask foolish questions. They are the innovators. They can find out they can ask new question, they can ask new answers because they don't have a pattern. So ICMR is trying to tap that ability of the students, that they specifically ask what is a novelty or innovation. Sometimes you may come out with some new techniques. We do not know. Sometimes you may invent a new culture media for your microbiology lab, so that we may be using some very, for example, when I was trying to study cutaneous leishmaniasis in Trivandrum. Cutaneous leishmaniasis, that particular promastigote form of leishmania, is grown in NNN media that is not available in Trivandrum. So we were trying to make that media using rabbit blood and all other things. Microbiology people were helping us like anything to prepare that particular media, which was not available in Kerala, because in Kerala, the kalasar is not very common. So that kind of things can be done. You can find out a new media where you can you can grow maybe some viruses. We do not know. So that is a very important thing. Sometimes you may invent a new incision for thyroid surgery, because if you do, even if the incision that you have put for thyroid surgery is reducing the bleeding, definitely it will has got some cosmetological issues, because it is just in front of your throat. And most of the people undergoing thyroid surgeries are young females. So if you are able to identify some other plane, maybe very much low to the thyroid, which is not, I think that kind of surgeries are already there. If you are able to identify that kind of things based on your, if you are a genius and you are able to identify the blood flow of vessels through the neck, and you can identify some particular plane, so that the incision in that plane, the bleeding will be much less, and cosmetically it will be much better. You can discuss it with your surgery professors, and you can come out with some new innovation. So I do not know what is the innovation is, because I am not an innovator. I am an old man. So that is a very important thing. So if you have got some novelty or innovation in your project, you describe it in 100 words. ICMR is giving you a particular area to explain this also. These things are very important. Whenever you are trying to conduct a study or choosing a research topic, or you are trying to find out a objective, we usually give a mnemonics. You just look at finer, feasibility, I will explain, novelty, ethics, and relevance. Feasibility is very important thing. For an undergraduate student, I think feasibility is the most important. So I may tell that you have to go for some innovative with novelty, so many things. But if I am given an opportunity or given a task to choose between feasibility and innovation, I will go for feasibility. Because feasibility is a very important thing. Whenever you do, it's not only the ICMR project. If you are trying to do your thesis, PG thesis, feasibility is the most important thing, because at the end of the day, you have to submit your paper and go. You cannot be there in the medical college for years. Feasibility may not be a big problem for me, because I am in the service for last 12 years, and I may, if I am not going to have that kind of ill health, or I am not going to die at a very early age, I may be there for years. So that is not a very important thing for me. I can think in maybe something innovative or something demanding. But for you, you may be there in the department for months. So that is very important. Feasibility is the first choice or first consideration. Novelty is very important thing. Ethics is a very, very important thing. Whenever you do or you practice anything in medicine, ethics is the number one thing. Don't do anything unethical. And the research ethics is something different from the clinical ethics. It is actually a part of clinical ethics, but it is different. For example, a patient is coming to you with some maybe fever. There is, you can just by asking a consent, you can just examine them, because there is an implied consent. The patient is coming to you with fever. You are a doctor. The patient very well know that you are a doctor. You are going to examine them. The patient know that you are going to examine them. But asking the permission is a courtesy. Definitely you have to do, and you have to ask permission. But if you are doing it for research, if the patient is your subject in research, you have to get the written informed consent. If it is a trial, the process of taking that consent should be recorded, video recorded. It's a very important thing. I'm just giving you one aspect of the ethics, but so many things are. So don't do any research that can harm the individual or harm the society. There is no scope for that kind of a research. As a doctor, we should not do that. That is a very important. And relevance. The relevance is also very important, as we were discussing post-COVID syndrome and all. So the public health relevance, clinical relevance, is very, very important. Then you may be wondering, what is I? To fill that mnemonics, okay, finer, the I is interesting. So feasibility, your subject or your topic or your question. Question means nothing but the question that your research is going to answer. It should be feasible, interesting, novel, ethical, and relevant. Interesting is something very synonymous to relevant. So to make that finer correctly, we are putting I also. Next one. It's not like that interesting means that by just hearing your topic, somebody is laughing. It's not like that. Interesting means it is creating some scientific interest. That's it. Next one. The 8D is a very important area. Actually, that is the project writing. So in 700 words, you have to describe the study setting. Study setting means where your data collection is taking place and the importance of that place. Okay, if you are, most often you are going to study some clinical settings of a medical college. Sometimes the field setting of a medical college, because for community medicine and all, there will be some field area inside the medical college, or sometimes there will be a rural area will be there maybe 25 kilometers from your college, and you can go there and do some community studies. Doing community studies are very, very important. Most often study done in communities are given more weightage than studies given in hospital, because it is very difficult to do community based studies. But again, just look at the feasibility. I am not discouraging you from doing community based study, but without a better help from your faculty, it is very difficult to do community based studies. Definitely it is easy to do hospital based studies. So when you are writing that, okay, my uh, uh, this setting is uh, internal medicine department of Government Medical College Patiala. Okay, you have to tell in another sentence what is the importance of that one. Then you can cite that, okay, this government medical college is catering 3 districts of southern, maybe Bihar or something like that. You can write. So that will just give you a glimpse that your study setting is very, very important. Then you have to write down your study design, and again you can write something why you are choosing that design, if that is very something very important. For example, I am choosing for a case control study to find out the risk factors of post-COVID syndrome. So I have got 2 groups. One group is people develop post-COVID syndrome after detecting COVID. Second one is people do not having post-COVID syndrome. So these 2 groups are compared, and my study design is a case control study. That you can write in a sentence. And sampling strategy. Sampling strategy is a very important thing. Sampling means how much generalizable is your study. The randomness of your study participants. For example, if you are going to a field area and you are trying to study the dietary pattern of that particular area, what they are eating. So you happen to be in a slum and you are taking so many people from the slum area, then you may have an impression that people are not consuming well. The food is scarce, the protein energy malnutrition is rampant. But if you happen to be in a posh area of the city, you may come out with something different. Both are wrong. So that is because of your sample. So from this population or the large group of people, post-COVID syndrome, people suffering from post-COVID syndrome is a large population. From this large population, how you found out the 100 people who are included in your study is very important thing, that you have to write it down. If there is some random process has taken place, you have to mention it was taken randomly. Even if there is no random process, you can write that how you assembled these people. Most of the sampling technique that we use in clinics are consecutive sampling. That means if my study participant or my eligibility criteria to include my study is a person suffering from post-COVID syndrome. So I am sitting in the OPD. If a person is sufficiently qualifying the inclusion criteria, I will include them into study one by one if they are able to provide me the written informed consent. That is known as consecutive sampling. That can also be used, but better you mention how the participants are enrolled to your study. That is your sampling strategy. Sample size calculation is very important area. Nowadays, it is given undue importance, what I would say. But that is there. So it is very important to get a statistical help for sample size calculation, because sample size calculation is important. For example, in Kerala, maybe all other part of India, you may be knowing mangoes. You may be knowing jackfruit also. Mangoes, I think it is universal in India. Jackfruit, I don't know how much it is. Suppose I have got a stone in my hand and I am aiming a jackfruit. It is very easy for me to hit the jackfruit, because jackfruit is very, very, very big thing. But if I want to hit a mango, sometimes I have to use 5 throws. But for jackfruit, only 1 throw, maximum 2 throw. So to hit a jackfruit, I need only small number of throws But for mangoes, I have to hit large number of throws. Sample size calculation is like this. To aim, I have written my aim and all. I am going to study this. What is this enough or sufficient number that may be enough to address this particular question? We have got some statistical procedures for addressing this issue. Better you use that statistical method because it may be impressive for people. But suppose if there is only 500 individuals suffering from post-COVID syndrome in your hospital and the record is available for the whole 500, I am going to take the whole 500. That is my sample size. That can also be there, but better to maybe impress the evaluators. You may go for a statistical calculation of sample size. We have got many methods to calculate that. I can take maybe a class on how to take sample size calculation. But better you get the help from your community medicine department because they may be better or best in giving you a better sample size with or without the help of statistician. So feasibility, you have to write down how much you are able to finish this work and expected outcome. Expected outcome is about the utility. Okay, you have found out something okay, because of that, community is going to get something that you have to mention the expected outcome. Maybe this is a very important thing, interdepartment and interinstitutional collaboration. I do not know how much you can collaborate with other institutions. If you are able to collaborate, for example, you are doing some genetic analysis of people coming out with post-COVID syndrome. So many people have infected with COVID, but only some is developing post-COVID. If there is some genetic predisposition, is it able to identify that particular genes? So in future, at the time of large pandemics that is going to appear in future, at that point of time, like we can use some genetic engineering so that to address the long sequelae of pandemics. So very bright idea, very good idea. But the problem is there is nobody is doing some genetic analysis in medical colleges. But some institutions will be in the periphery. Suppose if there is a researcher who is loving to collaborate with students, if you are lucky enough, you can have a collaboration. But the point is, if you have got a collaboration, that may be the collaboration with the medicine and pharmacology and microbiology in your institute, or it is a collaboration from the medical department of your institute with a genetic department of other institute. Collaborations are very, very important and it may be valued high because collaboration means you are a true leader. Only a leader can collaborate. Whenever it's my experience, if I alone write a proposal, even if the proposal is very nice, the chance of rejection is high. But if I am writing a collaborative proposal, the chance of acceptance is very high because collaboration means it is going to last. Because if I fail, my team or the person who is collaborating to me may be able to pull it up. That is a very important thing. So then timeline and budget. Timeline is about use of time resources and budget is about use of human or material or especially money, how you are going to handle money. Any funded research, if the funding agencies may be giving you only 1,000 rupees, sometimes the funding agency may be giving you 10 crore rupees, whatever it may be, it is your responsibility that how you are using that money. So budget is a very important thing. You can write it in a very simple way. That means this, okay, I have got only 2 heads. I have to buy some papers. Okay, I have to print some questionnaires. I have to travel like this or something like that. Also, I am using this 10,000 rupees or 20,000 rupees. So that is very important thing, but you have to write down. Okay. So next slide. Next. Okay. This is a timeline chart. It is otherwise known as Gantt chart. So you can use this kind of a chart to, or you can give a calendar. This is a very important thing. Usually in project writing, people use Gantt chart. Gantt chart. In this chart, you can see that from January half to or January to March, I am using for planning. But during the planning itself, I will start research. It is not about medical research. Okay. After research, I am going to design. But while the phase of designing start, my research will continue. That is the meaning of that overlap. Sometimes it may not overlap. If the bars are not overlapped, that means it is separated by time. But if something is overlapping, that means it is simultaneously happening. So the whole process will start by January and it will end by July. So this is a tool for the person who is planning this work. Suppose in March I am not able to, or in April I am not able to go for implementation. That means my work is actually delayed or it is lagging. So I have to increase my speed. So it is a very important planning tool, that is Gantt chart. Next one. Next slide. This is a simple budget. Okay, in budget, usually you have to write down what is the item and how much quantity you require. What is the unit cost for quantity? Unit cost into number of quantity, you will get total. Then you add, you will get the whole total. So, okay, this was my last slide. Next one. Next is my last slide. That is my thank you slide. And please see that your data is published. Very, very, very important. You do whatever thing. You may not be able to publish in a very high impact peer reviewed journal. You try to publish anything everywhere. Don't publish in predator journals. Predator journals means you are giving some money and they are publishing it without checking the quality of your data. Maybe your name will be there. If your name is there in predator journals, that is something you are becoming notorious. So try to publish it. And because you are, anyway, if it is a small research conducted by a medical student, or if it is a large, maybe a double-blinded controlled trial conducted by your professor, you are using that time, energy, and resources of your patients and the society as a whole. So it is very important thing. And let people recognize your contribution. And another advantage of the publication is you need not come to your mother department to again check or to receive a copy of your original work, because it is no need. It is there in the international databases that you have conducted the study already. So you can just give the link to your maybe your new project officers or the university, so that they can just check what is the importance of your study. So that is a very important thing, because most of the studies, even the PG thesis that is done in our institutions, are not published. So that is a very important thing. So if you start it, you end it well. That is a very important thing. So I have finished. I have got only 10 slides. Thank you. If you have got some questions, that I can discuss with you.
Thank you so much, sir, for the excellent session. Hope the knowledge gained out of this session will be of great help to our medical students and junior doctors who have joined us today. Thanks a lot for your time, sir, despite your busy schedule. Let us take a few questions from audience. Audience, please start typing your questions in the chat box.
Can you stop sharing the screen?
Yes, sir. So we have a question from Dr. Harsha Sashi. She's asking, is these kind of how this grant writing is useful for graduates? Like we have ICMR STS for students. Do we have anything for graduates or PG students, sir?
Usually, grant writing is not specialized, or it is not categorized for graduates, undergraduates, postgraduates, something like that. Anybody can write for a grant. If the grant is there supportable, usually funding agency will give you the support. But the problem is, one thing is, in India, undergraduate students are not coming up with research. There is not research culture. That may be the reason that this ICMR is coming out with helping the proposal by undergraduate students. If you are a graduate doing your postgraduation, you can write researches or grants proposals for agencies which is related to your research area. For example, if you are conducting TB research, we can ask funding from RNDCP. If you are doing some research in hemophilia, you can be help from dedicated programs. If you are conducting some studies in tribal area, tribal department has got dedicated funds for that. So it is just, you have to identify the resources that is available. So in whatever capacity, definitely you are going to get the research funding. But your affiliations are very important. If you happen to be a faculty member or you happen to be a professor, and if your name is there, already published so many papers, and if you are recognized so much, the chance of getting a funding will be definitely high.
Thank you, sir. Thank you so much, sir. Sir, next question is by Dr. Saumik. He has asked how to get our studies published in national or international journals.
It is very important to, this area of conducting the study is very important. If you have got a very good data with you, and if you are writing it nicely, there's high chance that good journals will, you can get it published in good journals. Another thing is, if you have got money, you can give money and publish. But sometimes that may be, as I have already pointed out, in predator journals. But there are good journals are also there. Nowadays, that is the culture. Because this is known as the open publication policy. What usually in previous years, because the journal people has to run the journal, so they need money. So what they usually do is, they will publish your data because your data is good. So many people will be enthusiastic to read your data because again your data is good. But the person who is reading this article has to pay money for the journal. That was a usual culture that was happening. But now it has changed. The money, you have to give the money to publish. It doesn't mean that your data is bad. Your data is good. But better you give the money so that the reader will get it free of cost. Who has got more money in your hand? You just have to think it in a Western perspective. Okay, suppose you are conducting some research in a Western university. Your research may be getting so many grants and you may be having enough money with you to get it published. So you give the money to the journal so that the reader who may be sitting in Africa, sometimes you may be sitting in some underdeveloped country, and he can access the article without giving the money. So nowadays, so many money is involved in research, but so better you ask for publication fee also when you ask for proposal. It's not for the undergraduate students, but generally, if you write for some proposal, you keep some amount of money to get it published in a very good journal, an open forum or open in this area.
Thank you, sir. Sir, we'll take last few questions. Dr. Bhagia has asked, sir, due to recent teachers' eligibility criteria at NMC, publication criteria have changed and it is difficult to publish in journals like IJPH and IJCM. How to solve this issue? How to find the truly indexed journals?
Actually, the new criteria is much better than the older criteria. The older criteria was you have to publish as a first author or second author, either first author or second author in some of the articles or journals. This journal selection, this indexation that was given, that included some predator journals also previously. So if you can publish some data which is invalid data could be published in your name as a first author or second author. That was the previous state of affairs. Now it has changed. You can publish it first author, second author, third author, or the corresponding author. First author, corresponding author, second author, or third author. That means in a single paper, you can claim authorship for 4 people. Rather than 2, they have made it 4. But the problem is, The journal should be a quality journal. So that is why our people are finding it very difficult to get it published. So that is actually a good sign for me, so that the quality of the papers will also improve because of that new change by NMC. That is actually a welcome stand from NMC.
Thank you, sir. So Dr. Gopinathan has asked how to get involved and interest in data collection. It is boring sometimes. So we'll keep it as a last question, sir. How to get involved and gain interest in data collection?
One thing is, it is interest as an adult. You are getting interested when you are involved and you have got some knowledge in it, and if you are going to getting something out of that, that is a very, very important thing. So it is a very, very basic principle in pedagogic learning and andragogic learning, that in pedagogic learning, the interest has to be created by the person who is delivering the lecture or who is conducting the session. But in andragogy, the interest has to come from the participant based on his experience, what he is going to gain out of that. So that is a very important thing. You try to acquire more knowledge about what you are doing, what you are going to gain out of that. Definitely the interest will follow. That is what I think, because for me also, I will just stop by sharing my personal experience. Before coming to medicine, I was studying BSc Physics, and one of my subsidiary was statistics. Because I am very much interested in physics, and my passion was to become an engineer, a space engineer. So that is why I went for this graduation in physics, but I found statistics very boring. But I turned to be a doctor, then a community medicine fellow, and now a researcher. And in every day I am dealing statistics with so much compassion and so much interest. So it will definitely change. If you involve, definitely all topics will be interesting. There is no boring topic in the whole world.
Thank you, sir. Thanks a lot for patiently answering all our queries, sir. Due to lack of time, we are skipping few questions. Now I'll request the National Chairman of IMA JDN, Dr. Shijit, sir, to give the closing remarks.
I think our National Secretary, Dr. Parul, has joined, and I'll request Dr. Parul to kindly say the vote of thanks. And before that, I think we had a marvelous session. In fact, I should say that, right now I feel as a real beginner, I have learned a lot. Thank you very much, Dr. Anish. And if I had to learn, I am sure that all our children would have learned much. You made it very simple and very understandable. And I'm sure that all of them would be excited. Yes, of course, Dr. Anish was given a very wide topic. So he had to, sort of address everything and anything and everything. And he also knew that he is addressing both the students and young doctors, so it becomes very difficult, because had it been specifically first year, second year, third year medical students, it would have been much more easier. So that is why he had gone into some depth and details regarding some of the proposals. So the very young children need not get scared with all these things. And he also had to address the young doctors also. So it is very general. And I would request Dr. Anish for two things. One, if he agrees to share the slides, maybe we can share it to all the students who have joined today, and Venkatesh can do that. And two, some of the doubts, the session was very short. He needed at least around 10 to 15 hours to explain everything. So, all the doubts which you have, you can send it to Dr. Venkatesh. And Venkatesh, you please, make them very concise, specific bullets, not everything, but very relevant 4 or 5 doubts. You can ask opinion of Dr. Anish, and then, get back to those students so that, those doubts can be clarified. And the last thing is that we are quite excited by both the lecture and the participants. So I think we'll take it up as a mission. Dr. Parul herself is a medical teacher. We'll take it up as a mission. And at least, if not weekly, we'll try for a fortnightly or at least a monthly webinar in which Dr. Anish and all his team can explain one by one each of these things, like study designs, statistical methods, randomization, and all these things. One thing at a time we'll take up in maybe around 10 or 14 sessions. MSN did conduct one last year, but the reach wasn't too much. but right now we'll try to reach many more. So I think it was a marvelous session to begin with, and I am extremely grateful to Dr. Anish for conducting this so beautifully and marvelously. And I'm sure that you have excited all young minds of medical students all over the country. Thank you very much. And now let me hand over to Dr. Parul to formally express the vote of thanks.
Thank you, sir. It is actually a privilege, or it is a happy thing that you remember my name when this kind of a topic has come into your mind. Thank you, sir.
Now I request our dynamic National Secretary of IMA JDN, Dr. Parul ma'am, to deliver the vote of thanks.
Okay, no, Parul was here right now, but suddenly she got disconnected. But anyway, that's okay. I think we have had a brilliant session. Venkatesh, you can express the vote of thanks and then we can close.
Thank you, sir. Once again, I would like to thank Dr. Anish sir, Dr. Shizit sir, Dr. Parul ma'am, and all our 500 plus registered participants for making this webinar a grand success. The certificates for the session will be mailed to you before this weekend. Thanks a lot, everyone. We are closing now.
Thank you very much. The meeting is closed.